What is the recurrence rate of endometriosis after IVF? So let's have a look at this research paper. Endometriosis is a chronic hormone dependent condition that often leads to pain and infertility. Many women with endometriosis need IVF or intrauterine insemination. However, the concern is that these hormone treatments, which are used, especially ovarian stimulation, which increases estrogen levels, may make endometriosis worse or make it come back after treatment. So, what did this study do? It analyzed 16 studies to answer a crucial question. Does ovarian stimulation and assisted conception increase the risk of endometriosis progression or recurrence? The studies included both small case reports and larger observational studies focusing on women of endometriosis who underwent assisted conception. Researchers looked at outcomes such as new or worsening pain, growth for endometriotic lesions, or starting new medical treatment. The review's findings were very reassuring. IVF does not generally increase the risk of endometriosis recurrence or worsen pain symptoms. This means that women with endometriosis usually pursue IVF will have no less chance of recurrence and does not make that disease worse. The impact of IVF on endometriosis or endometriomas is mild, if present at all. These conclusions are based on moderate to high quality evidence from multiple studies. However, the review found that intrauterine insemination may increase the risk of endometriosis. Coming back here, the evidence was much weaker. For women with deep invasive endometriosis, there's small possibility of progression during ovarian stimulation, but data again is limited. For everyday life, what does this mean? It means that if you have endometriosis and you're going through IVF, it is unlikely that your symptoms would get worse after the treatment. With intrauterine insemination, the reason why there may be a higher recurrence is that the success rates of intrauterine insemination are lower, and which means that you have multiple stimulations of the ovaries done over a period of time, which theoretically could increase the risk, but that data is not complete. So at the end, it is reassuring that doing IVF and stimulation of the ovaries does not increase the risk of endometriosis recurring. Thank you.